Welcome. Are you having trouble with the CST exam? Well, I imagine you clicked on this link because you want resources. Either you're trying to get back into the field, you're trying to get recertified, or you are a student about to take the CST exam. Well, I'm going to go over 10 questions today, give you a little bit of the idea of what the format that I normally do. And I have other playlists on this YouTube page. Just browse through them. They have a lot of similar videos as the one I'm doing today. But I'll put the question up in front of me. You can see the question. I'll read it to you. You can think about it, and hopefully you guys can answer the question correctly. If you want to pause it, because I'm going to give you the answer typically right after I read that question, because I have to go over 10 of these. Okay, so I'm going to jump right into it, not talk too much, just give you the resources you want. Okay, don't forget to like and subscribe. Okay, that helps me out. All right, first question, we'll put that up on the screen. And here it goes. Which of the following preoperative procedures should be completed for a diabetic patient? Is it increased preoperative medication? Is it increased preoperative insulin dose? Is it preoperative meals to avoid hypoglycemia? Or is it to put stockings placed on the patient, otherwise known as SCD? So think about it, okay? Hopefully you guys got the right answer. All right, the answer is D. Yeah, it's stockinettes, right? Why do we have to put that on a diabetic patient? Think about it. Anyone with diabetes is going to have poor circulation within their extremities, especially the lower extremities. And if they have poor circulation, we can get venous stasis. And venous stasis, or you can get clots, and obviously DVTs or any type of pulmonary embolism is what we're trying to avoid, especially with diabetic types of patients. All right, on to the next question. Put it up on the screen for me there, like I have someone working here. I'll put it up on the screen. The patient instructed to be MPO for 8 hours prior to surgery is to prevent what? Wound infection, ulcer, intestinal obstruction, or aspiration. Do you know what MPO stands for? That's nothing by mouth. They can't have food. Every surgery that's been canceled is because they got food. But why do you think that is prior to 8 hours? You probably know the answer. Maybe you don't. It's D, aspiration, right? We don't want to have gastric aspiration, right? Or food coming up into the actual lungs, right? So we're trying to reduce that amount of food within the stomach. So correct answer on that is D, aspiration. All right, moving on to question number 3. Put that up on the screen. Here we go. What is a surgical consent typically signed? When is it signed? Is it after preoperative medication are administered? Is it after IV has been inserted? Is it before perioperative or preoperative medication are administered? Or just before general anesthesia is administered? It's a lot of information there, right? So when is a surgical consent typically signed? Okay, let's just kind of go to the rationale and kind of see what they say. The surgical consent must be signed prior to a patient receiving any medication. So yeah, so C, right, before any type of medication is administered. You cannot give them a consent. They don't know what they're signing if they're not informed. That's actually the doctor in battery or an assault, right? So in this case, it could be a little bit of that. You can be charged for that. You cannot give them a consent. So a correct answer on that is C, right? All right, next question. Question 4. General consents. A general consent form authorizes what? So what is an informed consent? Is it hazardous therapy? What is that? Is it receiving general anesthesia? Is that what the consent's for? Routine medical treatment or experimental surgical treatment? So why are we giving a consent? That's pretty simple, right? That is for routine medical treatment. Like kind of goes hand in hand, right? You can't get any type of medication, otherwise you're not informed. And it's typically for a routine medical treatment as a consent, right? A general consent, because there's different forms of consent. There's specialty consents. There's a couple questions that will go over that. How are you doing? You getting these questions? I think they're pretty easy. About exposing you to some of these information here. So question number 5, we'll put that up on the screen. Which of the following must be completed preoperatively if a patient underwent a barium study the day of surgery? When you map this out, if you don't know what barium is, you're going to be in left field, right? That's obviously a barium swallow to get some contrast and look at your GI tract. So which of the following must be completed preoperative if a patient underwent a barium? A gastrotomy, a urinalysis, an emina, or a colonostomy? So what do they have to do prior? What do you think? That's not something we use every day or kind of go over every day as surgical technologists, but you should know that as patient needs and patient care, we should probably do C, an emina. Every person's dream. Not really, right? Why is that? Because we don't want impaction. Barium is going to cause the digestive system to slow down, and if we don't have pretty much everything cleared out, you can cause obstructions and in that matter. So C, an emina needs to be done post-operatively, or at least pre-operative, not post-operatively. In this case, we'll pull up the question number 6 here. Errors on a medical document can be corrected by what? So when you sign legal documents, how can you correct that? Is erasing it, like it was never there, deleting it, Control-Alt-Delete, mark through that, or just kind of cross it out, or do we have to mark through it with an initial? Yeah. The correct answer is D. You want to mark that, the correction, by kind of striking through it and marking an initial who did that. That is a legal, correct way to do that. Not to mention you should only use blue and black pens. But in this case, the correct answer on that is mark through a line, what have you, and initial it next to it. D was your correct answer on that. Question number 7, we'll put that up on the screen. But before I do that, if you're interested in CST and more information, I have a CST, I call it a Bible, but really is a guide with a lot of good information about pretty much every subject matter of the CST exam. Now, there's 2 ways you can do it. I will provide a link in this video, which you can use Venmo to pay for. It's $10. And all these resources go back to externships. Or in this video, just do a thanks. You know, I'm asking for $10, but if you do a thanks, look down on the bottom there, hit the button. It's a donation. You can do $2, you can do $5, you can do $10. If I see you do that, I just need your email and I'll send you this little kind of, it's about 3 or 4 papers. But it really is consistent of every situation, every answer. It really is a good resource. And I'm providing that to you. So if you could do that, that's in your interest, right? It's up to you. But again, all these resources will go to the CST exam or go to the actual students for externships gas cards, okay? Anyways, on to the next question, right? Question number 7, we'll pull that up on the screen. Which of the following must be obtained from a patient undergoing a surgical procedure, fertility treatment, chemotherapy, or an experimental treatment? Say that 10 times fast. Is it a general written consent? Is it a special implied consent, a special written consent, or a general implied consent? You're asking, what does all that mean? Well, this seems like it's an overly complicated. It's not a normal treatment. So you're probably going to go in a special category. In this case, it's a special written consent has to be done for order to do these types of treatments. The correct answer on that is C. Yeah, these are not something we use every day or something that on a normal tech would be involved, but you need to know this type of information for the CST exam. It might be on there, right? All right, question number 8, we'll put that up on the screen. Here it is. Hopefully you see it. How is the informed consent signed if a patient is illiterate? I've heard this a lot. Is it 2 physicians sign consents? Is it surgeon signs consent? He's just going to sign it for him? Is it a verbal consent of the patient? Or the patient marks with an X? You probably heard this one before, but yeah, if the patient is illiterate, he can just mark with an X. That is his signature to verify the consent is signed. So the correct answer on that is D. We're about 9 minutes and 55. So we're going on to question number 9. Put that on the screen for me. Which level of Maslow's hierarchy of need is the most applicable to a surgical patient? So which level of Maslow's hierarchy of need is the most applicable to the surgical patient? Is it esteem, prestige, love, belonging, safety, security, physiological, or survival? So this is the Maslow's hierarchy of need, Abraham Maslow's. So you need one of these before you can get to the top. The most basic thing is your D, that you can apply is your physiological and survival, right? All the other stuff probably comes hand in hand, but the one that applies to surgical need is D, is the correct answer. So yeah, you're in that first class, fundamental class in surgical technology. You go over Maslow's hierarchy of need. You're like, why do I need to know about that? Well, one, it's going to be on the CST exam. And two, obviously this does apply to surgery and the sense of their needs. All right, we're coming to the last one here. If you put your name in the comments, obviously I can provide some other resources. All right, we're coming to the end. Question number 10. If you can thanks in the bottom or hit that thanks button on the bottom, I will provide some other resources to you. If you put your name in the comments, who knows, I might add some information for you. Hey, let me know what type of information you're looking for. Let me know your journey. Where are you from? Are you just starting? Have you been in the field for 25 years? I heard a lot of other comments in previous videos. It's really encouraging to see everyone that's enjoying these types of videos, and hopefully they're passing, right? Because there's a lot of resources, and I know it's a daunting issue. Hey, if you don't pass and you miss it by 3 or 4, don't get discouraged, okay? Because this question or these tests are all over the place, and it's only a 98 to pass. That's a 65%, okay? Keep doing it. I know the whole idea is you have to pay for this stuff again, but trust me, you're not the only one that fails this occasionally, but don't get discouraged, okay? Keep studying. All right, don't forget to like and subscribe on the bottom. All right, question number 10, we'll put that on the screen. A patient may be asked to shower at home with an antimicrobial soap before coming to a hospital for surgery. Why are we doing that? Is it to achieve the cumulative antimicrobial effect? Is it to determine if the patient is allergic to the soap? Well, that would be awful. Is it to reduce the amount of time for the perioperative prep? Or is it to leave a visible film so the preoperative borders will show? So why are we asking the patient to do an antimicrobial soap at home prior to surgery? So the correct answer is going to be C. It's going to reduce the amount of time for the perioperative prep, right? Let me go to the actual rationale and read it to you because it is pretty interesting. Well, actually, I was correct or incorrect. It's going to be A. It's going to actually, studies have shown that patients that shower between antimicrobial soap at home prior to having surgery demonstrated a decrease in microbes on their body. So, correct answer on that is actually A. And it's going to help with decreasing the microbes on your body over a long period of time. So by the time you reach surgery, it's going to be reduced because you can't be 100%, right? So reducing it is really important to minimize surgical site infections. So anyways, if you check out these other playlists that are available, I'll put that on there. That has other resources just like this video. And don't forget, if you want the CST exam, the extra resources, just hit the thanks button. Or look at the link below because you can just go right there and pay through Venmo. It's $10. If you do one of the above, I will provide that through an email that you provide me. Anyways, thanks for watching, and I'll see you in the next video. Thanks.